perspective. And what we mean by that is that we've really been focusing equally on the care delivery processes and how we deliver services to patients and families. And so we're on a transformation.
Can you be a little more specific with that? Because
Absolutely.
I'm really not sure what you're really referring to.
Absolutely. So really what it's all about is trying to engage our staff, our physicians, and others who deliver care and service to our patients to understand what's working, what's not working from their perspective. We also take the feedback and the information that we see and hear from our patients and our families, and we put our processes through an evaluation where we look at how we're delivering care, and we look for opportunities to actually make that care delivery better from the patients and families' perspective. So we've been doing a lot of work and activity to try to eliminate steps that, or activities that really don't add value or meaning to patients and families. It also takes up time for our clinicians doing things that may or may not be valuable, helpful, and meaningful. And so the more that we can make our processes more effective and more efficient, then we also free up the time for our staff and our physicians to be able to be more in a position of providing direct care and support.
Could you give an example of that, where you have realized some duplication maybe of efforts and reduced the cost of operating and made it more streamlined for your the doctors and nurses and the patients?
Certainly. So one of the examples I'll give you is some work that we did between our emergency department, laboratory services, and really through the organization. So one of the things that we heard from our laboratory service is that we were receiving tubes of blood to be tested, but if there wasn't a certain amount of blood gathered in a particular way, then that blood could not be processed, and we would have to go back. The lab would have to call back to the team, advise them that they would need to actually do another, what we call a poke for the patient, so the patient would have to experience another blood draw. And there's also delays, of course. If people are waiting for blood work and the blood can't be processed, so that process has to start all over again. So when we look down at what's exactly leading to this problem happening, that we are having to do so much rework, more than we would want to see, it ends up that it was really about how we were actually educating our nurses around how we might collect this blood and what they needed to look for. And so in this case, it was a matter of actually retraining our staff on what it is and what they would need to do in order to effectively draw the right amount of blood.
Cutting red tape and reducing the bureaucracy and getting right to client care.
Absolutely.
And we have a caller right now. Karen is on the air, and she wants to talk about wait times and emergency wait times. Karen, are you there?
Yes, I am.
Okay, go ahead and fire away.
Well, what I'd like to know is why I have to wait so long in the emergency department to be seen. And I'd also like to know if you could post your wait times online so that I would know in advance before I visit the hospital.
Well, there's a great idea in terms of being able to actually use some potential new technology to be able to help advise and inform before people come to the hospital how long they may need to wait. It is the wait times in the emergency department is actually something that we get asked a lot of questions about, and it is an area of particular focus and emphasis for us as well as for the province. And that we worry about and measure wait times because it's not just about convenience or speed in which people want to be seen. For us in the hospital, it's particularly in the emergency department, it is really a quality measure that it's very important that when people are coming to the hospital in an emergency that we see them. They're seen by our triage team effectively and quickly. They move to see the emergency physician, and they get the diagnostic tests that they may require underway so that we can understand in a timely manner what may be the cause of concern. And it's very important that that is done quickly but correctly in order to make sure that we provide the right therapy and the right interventions for an individual. Sometimes the types of things that get in the way of contributing to longer wait times is volumes of people that are in the emergency department at any given time. But the biggest factor that causes delays in being able to be seen in the emergency department tends to be the number of admitted patients that are sitting and waiting for a bed in the rest of the hospital. So we are excited that the new tower does provide us with a bunch of private rooms. So the new tower actually is 70% private rooms, which makes a tremendous difference in terms of being able to move people to the right room at the right time. And in the absence of having that, we often would have to make multiple moves, and it's like a puzzle trying to find everybody an appropriate place in the hospital that would meet their needs.
And Anissa, if the province is giving us 67 cents of every dollar, where are the dollars allocated from the foundation, Joseph Brant Foundation?
So typically, the government doesn't fund equipment. So if you think of it with respect to a house, they build the house and the foundation and the community furnishes it. So a lot of the time, as with the city's contribution of the $60 million, it's going to support equipment. In the case of the foundation, ours is a bit of a blend. There is some capital, there's some equipment, and overall we're just filling in the gaps to ensure that we have a fully functioning and new hospital for our community.
Okay, because it seems to me health care is equal across the province. Conceptually equal across the province. But if the municipalities are raising the funds, doesn't that make it unequal? In other words, Burlington is a municipality that can raise X number of dollars, where North Bay can't raise that kind of money. So it really throws monkey wrench into that equality equation, doesn't it?
Well, it's hard for me to answer that on behalf of other communities across the province. We are very fortunate in Burlington that we have a community that is able to come forward and have been so incredibly generous, truly. We're very close to reaching our goal. I'm not going to tell you. No, we're very, very close.
You say close.
Yes, we're at 52, officially we're at 52 million. We will be making a new announcement at the end of June at our Crystal Ball Gala, which actually will be taking place in the new patient tower. Prior to patients moving in, we have the opportunity to bring guests into our public areas so they will see the tower firsthand this June.
And I'm not sure who is best to answer this question, but when the province funds, is that money allocated for just the house, as you say? And does it go to beds in the hospital? And what are we getting in terms of that $60 million in terms of increased beds?
Are you referring to the capital campaign and the redevelopment
Yes.
specifically?
Yes.
Okay. So, Cheryl, if you want to speak to the government funding. In this particular project, it is at the formula based on the capital needs entirely. So the province has given us significant funds to be able to build this new hospital. Of the
But
$60
who
million,
gives you the funds to operate that hospital?
that would be the government, and that would be following the opening of the new tower. So Cheryl can probably respond.
So there is a process.
We just got a minute before the
Okay,
the break.
It's a post-construction operating plan process where there are negotiations with the ministry about the volumes of patients that we will serve after the tower opens. And the funding is associated with the volumes that we would offer to serve.
Okay.
It's not linked to beds per se anymore. It's activity-based funding.
Okay. All right, let me ruminate on that a little bit during this break and see if I come back with another question. But we're talking to Anissa from the Joseph Brant Hospital Foundation and Cheryl from the Joseph Brant Hospital, and talking about healthcare and what we're doing in Burlington and what campaigns are underway to raise funds for Joseph Brant Hospital. Anyway, we'll be back in just a moment here on The Issue on Cogeco TV. I'm Mark Carr. Welcome back to The Issue. I'm Mark Carr. My co-host is Brian Hegel, and I'm going to let Brian take it from here.
Well, Mark, in that last segment, I learned, like many citizens in this province, funding is a very difficult thing to understand. It's a very competitive world in the healthcare system. But I want to ask,
should it be competitive in the healthcare system?
well, that's a very philosophical question.
Yes, it is.
As you said, notionally, it is equal, and it's fundamentally, it should be provided and available. I think the statistics tell me something about the fact that, see if I got it right, 94% of Ontarians have access to a regular doctor or a place of care. So it's not a bad record. The question is the quality of care, the quality of experience. And I want to now bring us back to not just the funding, but the delivery on the front lines of any hospital. We've already had a caller talking about wait times. That's close to most people's hearts, and literally, in terms of priority. Other things are minor, but let's tell us what's going on with the new transformed hospital. What about parking? Is there more parking? Is it easier parking? Does it cost more? And who's getting the money from all that parking? Who would like to answer that one?
I can answer that question. There will be significantly more parking spaces once the new tower opens. So as many people in the community know, we've opened a new parking garage with 800 parking spaces that serves not only the hospital, but on weekends, we've noticed the community is using the parking garage as well. It's in a wonderful location to serve the waterfront. With respect to parking costs, there are costs. Every hospital in our province has the task of generating revenue through parking. So it is benefiting directly patient care. It is run by the hospital, and it is mandated most recently by the province in terms of limits and multi-day passes and those types of things to try and make it as cost efficient as possible.
So parking to me is one of those things. You'd like to do more, you often have less, but you also have, whether it's the provincial government or other restraints put on hospitals. They have to balance budgets, for example. That's a tough one to do in a time of fiscal restraint. And here we are building a new hospital. They seem to be diametrically opposed concepts. But I have another question, maybe before we go to a clip of what we can show people what we're talking about in Burlington at Joseph Brant. But here's a question that I'm often asked. Oakville Trafalgar Memorial Hospital has also a relatively, well, very new hospital, entirely new. Here in Burlington, we have a new hospital which is redeveloped and expanded. If I'm in the middle of Burlington, which is where growth has been in Burlington North, well, in particular, if I have a medical need, where should I be going? Now you're going to have to sell me on Joseph Brant. Why would I go to Joseph Brant versus perhaps I should just be going to Oakville Trafalgar, which is not by the water and constrained by a downtown, but is up near on a highway or two that allows me easier access and certainly a lot more parking. Mm-hmm. But let me throw that over to both of you to answer that, because I'm sure you've heard it at the foundation, and Cheryl, you've probably heard it from several sources.
I've heard it from patients.
And patients included, especially.
So I would like to respond to the access piece with respect to where the hospital is located. It's located in an area that anyone in Burlington can get there at the most within 20 minutes. It's off many highways, like you can get to Burlington. I live in North Burlington. I drive to work every day, which is in the hospital, and I can get there within 15 minutes.
Good thing you don't rely on public transit, but that's a different issue for another show.
But I think the other important thing, and I'll let Cheryl speak about this a bit more, is when your family doctor is in Burlington, you want to go to the organization where they have privileges or where they're most familiar. In our case, we also have a number of new residents who have decided to work and live in Burlington and have their practice in Burlington, who are being trained through the Halton McMaster Family Health Center, which is part of our hospital. They're being trained in our hospital. And those new physicians are most familiar with our hospital. They will have privileges in our hospital, and you want that consistency of care. And I'll let Cheryl add to this as well.
I mean, hospital care is really about illness care, and it's episodic in nature, right? When something happens, you come to the hospital, you get treatment for that, and you go back into the care that you need in the community, and you see your family doctor. And I think what makes Joseph Brant an important hospital, an important thing for the residents of Burlington, for the community, is to recognize that really what we're trying to build here is not just a hospital. We're trying to build a system of services of healthcare services for the people of Burlington. And so we have very strong connections in with family practice, and many of our family doctors who are in the community still come and provide care and will treat their patients while they're in the hospital as well, and then continue to follow them back into the community. We also have very strong collaborative working relationships with the community care access centers. So this is really about supporting people to have effective care into the community so that there isn't actually a break in care. We do know that some of the riskiest points in healthcare are at transitions of care. And so being really accessing care within a system of services that are connected and integrated and are used to and have effective processes of working with each other is really important from both a quality as well as a safety perspective. And so it's really about a system of care, not just a hospital.
That's a pretty good selling job. But as a patient, I still have choice.
You always have choice.
Always have choice.
That's a fundamental principle in healthcare.
Just a very quick comment. I think our viewers have been looking at the visual of what's going on in Joseph Brant Hospital. You can see elements of the old hospital and a lot of the brand new part of it, which is exciting. And I'm still teasing this. We're going to talk about the tower and Join the J, which is not an initiative by Justin Trudeau's government to support the legalization of marijuana. Some generations may get that, but in any event, one question that I do want to ask before we move on is in terms of the choices. You talked about a little bit healthcare in Halton. When I hear that, and if I go online and check, I'm going to see Oakville, I'm going to see Milton and Georgetown, but not Burlington, which is in the region of Halton. And you mentioned Burlington is aligned with a different healthcare system out of Hamilton, the Lynn, which we don't want to talk about too much because we already had issues about talking about funding. But what are the benefits of not being in one versus the other? Why is Burlington, why are we not, first of all, if you can say it in 30 seconds, why we're not with the rest of Halton? And why is it beneficial that we are not?
Well, I think for a couple of reasons. One is that based on the location of the Burlington Hospital, we actually don't just serve the Burlington community. Right. Certainly it's a primary catchment area for us, but we do service some of the communities in Hamilton as well, right? So Flamborough, Waterdown, et cetera. And so and certainly we have patient coverage in both of those areas. But the other piece of it is that for our tertiary care providers, so for things like cardiac care, so when you need a cardiac catheterization, right. Our tertiary care providers are in Hamilton. And so we have a strong collaborative working relationship with them on tertiary issues, not just the Hamilton Health Sciences, but also the St. Joe's in Hamilton as well. So both of those organizations provide regional services that really do round out the care and services that we offer at Joseph Brant. And so anything that we can't provide, we have strong working relationships into our tertiary centers. We create the processes by working through our physicians and through our nursing staff to transfer those patients safely over to get the tertiary care they need. And in many instances, once that care is received, those patients are repatriated back to Joseph Brant, where we can continue their care and then work to effectively transition them back through into the community.
Okay. We have another caller, Kevin. Are you there, Kevin?
Yes, I am.
Okay. Let's have your question, please.
Yeah, I've been noticing some Join the J signs around the community, and I was just see that they're in support of the Hospital Foundation. I was wondering if I could hear a little bit more about the campaign and how we could get involved.
Sure. Thanks for the call, Kevin. That's a great question. As many people may recall, last fall, A significant number of Burlingtonians and beyond our borders came together in Spencer Smith Park to form the largest human letter J in support of our hospital. And so we've coined our campaign for the whole community to come out and engage with the hospital and show their support for the hospital. Join the J. We launched that last October with fantastic outpouring of support from our community. It was incredible, and I know what Brian is going to say to me about Queen's University, but I'll let that go. It was a fantastic outpouring of support from our community, and we wanted to continue to build on that and invite the community to continue to show their commitment to and support of Joseph Brant Hospital. So we are continuing with our Join the J campaign this spring. You will notice a number of lawn signs popping up all through the city of people showing their support for our hospital, basically inviting their neighbors and their friends to also join the J. And I think it's important to note that Join the J is about more than making a donation. It's really about pride in the hospital, the realization that Joseph Brant Hospital is committed to our city, and that we would like our community to show its commitment to our hospital, because together, when people come together, we can make great things happen. And that's certainly what we're doing through our campaign, through the work of the professional staff at Joseph Brant and caring for our community, working with our partners, as well as the whole community showing their support.
I know we've got a sign up.
Thank you.
And you're welcome. At the beginning, I thought it was an NDP rally or something, just because of the orange on the signs. We have got video of the tour of the hospital. So, Joey in the control room, maybe we can run that now.
So we're going to take you into one of the private rooms. We're going to take you into the new main lobby. There's actually a new address. We're going to be coming off of Lakeshore as opposed to the historical address of 1230 North Shore Boulevard. Lots of natural light. We actually have spent a lot of time looking at the design of this. And so, for example, 75% of our patient rooms have a view of the lake. The other 25% actually view the bay and the escarpment, which is spectacular. So there's really no bad views from this hospital anywhere for any patients that are in the hospital. We're going to take you into our new ORs. The new ORs are twice the size of our current ORs. Best in technology, obviously, in terms of the kind of equipment, obviously lighting, audiovisual, everything that you would expect in a brand new, modern, state-of-the-art facility. But yeah, we'll be doing tours for the general public later this summer, and obviously we'll be going live, having our first patients in the building August 20th and 21st. So first full day is August 21st.
So, that was a nice little clip about how the hospital is growing. That amazes me that the operating rooms are twice the size of the original operating rooms. Mm-hmm. That's quite different. Brian, you were, I believe, going to ask about how the hospital foundation or the hospital communicates with folks out there.
Yeah, my first observation, just from my own experience, having been raised in Burlington, I mean, the hospital was not a place you wanted to go unless you had to, so it was over there. When I got on the board, and particularly at the time when the new era of Joe Brant started, there was a shift, and it was more of a modern shift, recognizing you needed to communicate, you needed to reach out, and that's been very different, and the Join the J program is just the current, I think, symbol of doing that and representation, to engage people beyond when you need the hospital. You want it to be there when you need it. And I think what I found is, when I got on the board, was the first time they'd ever brought in like a communications officer to actually coordinate and communicate with the public. I also know now that the hospital is doing something which is somewhat risky. They're out on social media, on Facebook, on Twitter. They're putting themselves out there. They've been at festivals, other events. So from your standpoint, has that been effective? And is that something that's going to continue? Because the more you put yourself out there, the more you tend to open yourself up for, inspection, criticism, but also, I think, new opportunities.
And just before Anissa answers that question, we're going to take a break.
Oh, that's a dramatic pause.
And
That's fantastic.
Your lead up was great to the question, but if Vanessa can just think about the answer, and then we'll get back to that question right after these messages here on Cogeco TV's The Issue. I'm Mark Carr with co-host Brian Hegel. We'll be right back.